Hello, oncoming nurse. This is Amanda reporting off on the patient in room 72. It's been a long night. I'm exhausted, but I'm just going to give you a report on this one patient. So, Mrs. Gifford in room 29 is a 73-year-old female who was admitted with increasing edema of her right lower extremity due to a DVT and possible right lower lobe pneumonia. She has a past medical history of diabetes, acute renal failure, peripheral vascular disease, congestive heart failure. She had an MI in 99. She's had other DVTs in the past. She's had a TIA in 2010. She's had chronic anemia, degenerative joint disease, and cellulitis and obesity. She came from a nursing home called Rittenhouse Nursing Home. Just because you don't have her printout of medications, I'm going to give you her medications. She's on iron, Lasix, Neurontin, glyburide, Lipitor, Plavix, Toprol, Lantus, aspirin, Depakote, Lovenox sub-Q, and sliding scale insulin. So she had a pretty good night. She slept pretty well. Neurologically, she awakens easily to voice. She is alert and oriented to self and place, but doesn't know the date. She moves all extremities weakly. Her left is actually stronger than her right side, probably from her maybe TIA. She denies numbness and tingling. She has was tired, so she had not Zofran. What am I trying to say? Ambien before sleep. So she was a little bit. Her speech was a little bit slurred, but this morning at 6 a.m. she came out of that and had clear speech. What else? She was appropriate. She was not confused. And she calls when she needs you. She also complained of pain in her right lower extremity, which is has the DVT. So I gave her 2 Tylenol at 4 a.m. And it was 6 out of 10 aching pain. Cardiovascularly, she has an irregular heart rate. Her vital signs have been stable. Her blood pressure is 128 over 78 last time I took it, and her pulse is 88. Um, what else? Cardiovascular. She has an IV running at 100 milliliters an hour of normal saline with 20 a K. I think that's it for cardiovascular. Pulses. So she had her upper extremities are fine. They're 2 plus bilaterally on her radial pulses, but her PT and DP pulses. Her right one is only it's not palpable. You have to use the Doppler to get it. And the left one is maybe only 1 plus. And then the edema in her right leg is like 3, 4 plus pitting edema. It's huge. And I kept it elevated on pillows. The left leg is more like 2 plus. So then, respiratory wise, she is 96% on 2 liters humidified nasal cannula. She is needs to use her incentive spirometer because she's been laying in bed. She's tired. She has that right lower lobe possible pneumonia. So her lung sounds are decreased in the bases, but also she's got some scattered wheezes and some rhonchi, more in the right than the left. And she does have a positive cough. Um, and then GI, she's on a diabetic diet. She doesn't have much of an appetite. She had her last BM yesterday and doesn't complain of any nausea, vomiting, or diarrhea. It was a normal BM. GU, she has a Foley in, which I'm not sure why they're keeping there, but it's putting out, normal clear yellow urine with, I think she only put out 250 this shift so far. I'll go check it before I leave, but I might be a little worried about her urine output. And then skin-wise, she has fragile skin. She has an IV in her left AC. She has a saline lock in her right hand. She has a stage 2 pressure ulcer over her sacrum. And what else? Some scattered old healing bruising and abrasions just from her skin being so fragile. And then lab-wise, her sodium is 133, and her potassium is 3.2. Her BUN's 17 and her creatinine 0.4. And her last blood sugar at 4 a.m. was 158. And I think that's it. So as soon as she gets up and works with PT, and they're content that her DVT is not going to move and that she doesn't need a filter placement, then she'll go back to Rittenhouse. Have a good day. How do I turn this thing off? I don't know.